name is Melissa Purvis, and I am the risk manager for the hospital. I was lucky enough to receive my COVID vaccine on December 23rd, and I will tell you it was the best early Christmas gift that I've ever received. I was super excited to get it. I have a huge family. Part of the reason we moved down here from Atlanta was because we just have a great extended family and wanted our kids to grow up near all of their relatives. But part of that meant, wanting to protect my family from COVID as well. So the fact that I was able to be one of the first community members to be able to get the vaccine by virtue of working for the health system, I jumped at the opportunity to take that one step to protect not only me, but to protect my family as well. I hear a lot of friends and family members who are very concerned about getting the vaccine because they've either not had any children yet or they're thinking about having children. I actually was a fertility nurse in Atlanta, and so one of the first things I did is those family and friends were telling me their concerns as I reached out to one of the physicians that I worked with, and she sent me a really great article that really addressed this issue. This article talked about how initially this sort of misconception spread because it was inaccurately stated that the COVID-19 vaccine would give you a protein that would break down the placenta, and that's not true. That's not in the COVID vaccine. But also what we know now is there's a far greater risk for pregnant women to get COVID-19 because we don't know what effect it will have on their pregnancy, getting the actual virus. So I think the knowns of the risk of getting COVID-19 when you're pregnant, those known risk factors should be way more concerning than the unknown risk of getting a vaccine, like any vaccine, the flu vaccine or any other vaccine. The person wanting to wait and see how other people respond to it could be exposed to someone who has COVID and they could contract it, and we don't have enough data out there right now to know how that person could respond to COVID. Sometimes you may be a young, healthy, 20, 30, 40-year-old and think, I have no comorbidities. Even if I were to get COVID, I would not be affected. But what we're seeing patients who are in their 20s on ventilators and who have not had comorbidities. So I think the time is now to get the vaccine. How fortunate are we to live in a country that was able to pull together this vaccine so quickly. So I think to wait and see is just a very dangerous mentality.